Anacin Tablet is a combination of aspirin and caffeine. It is used to treat many aches and pains due to various conditions such as headache, toothache, menstrual cramps, or muscle aches. Aspirin is known as a salicylate and a non-steroidal anti-inflammatory drug. It relieves pain and decreases swelling. Caffeine may help increase the effects of aspirin on pain. Indications: Anacin is used to treat headache, muscle pain, minor arthritis pain, and fever or body aches caused by the common cold. Anacin is sometimes used to treat or prevent heart attacks, strokes, and chest pain angina. Anacin should be used for cardiovascular conditions only under the supervision of a doctor. How to use: use Anacin exactly as directed on the label or as prescribed by a doctor. Don't use in larger or small amounts or fall under the recommended. Take with food if Anacin upsets your stomach. Dissolve the powder of Anacin tablet in at least 4 ounces of water. Stir and drink this mixture right away. If you need surgery, tell the surgeon ahead of time that you are using Anacin. You may need to stop using the medicine for a short time. Don't take this medication if you smell a strong vinegar odor in the Anacin bottle. The medicine may no longer be effective. Contraindications: you should not use Anacin if you are allergic to aspirin or caffeine, or if you have a recent history of stomach or intestinal bleeding, active bleeding caused by hemophilia or another blood clotting disorder, or an allergy to an NSAID, non-steroidal anti-inflammatory drugs such as Advil, Motrin, Aleve, Ardus, Indocin, Ladin, Voltaren, Toradol, Mobic, Rolafin, Feldin, and others. Don't give this medication to a child or teenagers with a fever, flu symptoms, or chickenpox. Aspirin can cause Ray's syndrome, a serious and sometimes fatal condition in children. Anacin may cause stomach or intestinal bleeding, which can be fatal. These conditions can occur without warning while you are taking this medicine, especially if you are aged 60 or older. If you have a stomach ulcer or a history of stomach or intestinal bleeding. If you take a blood thinner, warfarin, Coumadin, or steroid medicine. If you drink more than 3 alcoholic beverages per day, or if you take the medicine for longer than recommended. Precautions: if you are taking Anacin to prevent heart attack or stroke, avoid also taking ibuprofen, Advil, Motrin. Ibuprofen may make Anacin less effective. If you must use both medications, take the ibuprofen at least 8 hours before or 30 minutes after you take the Anacin, in an enteric-coated form. Avoid drinking alcohol while you are taking Anacin. Alcohol may increase your risk of stomach bleeding. Aspirin may cause stomach or intestinal bleeding, which can be fatal. Aspirin can also cause a severe allergic reaction. Get emergency medical help if you have hives, wheezing, or swelling in your face, lips, tongue, or throat. You should not use Anacin if you have an active bleeding disorder such as hemophilia. Don't give this medication to a child or teenagers with a fever, flu symptoms, or chickenpox. Aspirin can cause Ray's syndrome, a serious and sometimes fatal condition in children. Anacin side effects: get emergency medical help if you have any of the signs of an allergic reaction to Anacin, hives, difficult breathing, swelling of your face, lips, tongue, or throat. Stop using Anacin and call a doctor at once if you have ringing in your ears, confusion, hallucinations, rapid breathing, seizure, convulsions, severe nausea, vomiting, or stomach pain, bloody or tarry stools, coughing up blood or vomit that looks like coffee grounds, fever lasting longer than 3 days, or swelling or pain lasting longer than 10 days. Common Anacin side effects may include upset stomach, heartburn, drowsiness, or mild headache.